Stay alert. 5 surprising signs your liver is suffering. Did you know that liver disease affects over 30 million Americans? That's almost 10% of the population struggling with a vital organ that we often take for granted. The liver, your body's silent guardian, works tirelessly to filter toxins, aid digestion, and regulate metabolism. But when it's in distress, it may not always shout for help. Sometimes it whispers. In today's fast-paced world, we're often caught up in the daily grind, seldom stopping to consider the toll our lifestyle can take on our bodies, particularly on organs like the liver. The liver is a powerhouse of an organ, crucial for digesting food, storing energy, and removing toxins. However, its resilience has its limits, and the signs of trouble might not always be as clear or as immediate as we might expect. The reality is, liver health is pivotal to our overall well-being, playing a role in everything from our energy levels to our complexion. But beyond these broad strokes, the liver's well-being affects our quality of life in profound ways that can go unnoticed until serious issues arise. It's an organ that forgives but doesn't forget. Years of subtle neglect can suddenly manifest as critical health issues, disrupting lives and causing widespread distress. In our video today, we'll delve into some unusual and often overlooked signs that might indicate your liver is struggling. Recognizing these signs early can make a significant difference in treatment outcomes and overall health. We'll not only uncover these signs, but also explore practical solutions to address them, emphasizing that timely action can reverse or manage the damage and restore health. This topic isn't just about health. It's about maintaining the quality of life and ensuring that you can enjoy life to its fullest without being held back by underlying health issues. So let's pay attention to what our body is trying to tell us, take proactive steps towards health, and respect the organ that plays a pivotal role in keeping us active and alive. 1. Yellowing of the skin and eyes, jaundice. Jaundice, a term many have heard but few fully understand, is often one of the first clear indicators of liver distress. It manifests visibly as a yellowing of the skin and the whites of the eyes. This discoloration is due to bilirubin, a yellow pigment formed from the breakdown of red blood cells. Under normal circumstances, the liver processes bilirubin, which is then excreted through bile. However, when the liver is damaged or failing, this process is disrupted. As bilirubin builds up in the bloodstream, it begins to deposit in the skin and mucous membranes, leading to the characteristic yellow tint of jaundice. This symptom is not just a superficial concern. It is a potent sign that the liver is not performing its critical functions. It can be associated with various conditions, all warranting concern such as hepatitis, cirrhosis, or liver cancer. Understanding this sign is crucial as it is not only an indicator of current liver impairment, but also a warning of potential severe complications if left unchecked. Upon noticing any yellowing of the skin or eyes, it is imperative to consult a healthcare provider immediately. This symptom requires urgent medical evaluation to determine the underlying cause and to prevent potential life-threatening complications. The treatments for jaundice depend significantly on the underlying condition affecting the liver. In some cases, medications may be prescribed to treat liver infections or to reduce inflammation. For others, lifestyle changes such as adjusting diet, reducing alcohol intake, and managing cholesterol can support liver health and reduce symptoms. In more severe scenarios, surgical options might be necessary. These can range from procedures to remove blockages in the bile duct to more invasive interventions like a liver transplant, which may be considered in cases where the liver damage is irreversible. The approach is tailored to the individual's specific medical condition, overall health, and the progression of liver disease. Addressing jaundice promptly is crucial not only to alleviate this particular symptom, but also to improve overall liver function and health outcomes. Engaging with healthcare professionals allows for a comprehensive management plan, ensuring that each patient receives the most effective and appropriate care for their situation. 2. Itchy skin. Itchy skin, medically known as pruritus, can be a less commonly recognized sign of liver dysfunction. When the liver is unable to effectively process and eliminate bile salts, a natural product of digestion, these salts can accumulate in the bloodstream and eventually deposit in the skin. This accumulation triggers irritation and a persistent itching sensation that is not relieved by scratching. The discomfort can be widespread or localized, often worsening at night or in warm conditions. Unlike typical skin irritations, the itchiness related to liver problems does not usually come with visible rashes, making it particularly perplexing for those experiencing it. This kind of itching specifically suggests that the liver is not just sluggish but significantly impaired in its ability to detoxify the body. Common liver conditions associated with itchy skin include biliary cirrhosis and chronic hepatitis. Recognizing and addressing this symptom early can be vital in preventing further liver damage and improving quality of life. Managing itchy skin caused by liver dysfunction involves a two-pronged approach, alleviating the symptom and treating the underlying liver condition. Over-the-counter moisturizers and medicated creams can provide temporary relief. For instance, lotions that contain menthol or calamine can soothe the skin and reduce irritation. Antihistamines may also be helpful in managing the itch, though they do not address the root cause. However, these measures are merely symptomatic treatments and do not cure the underlying issue. To effectively tackle the problem, medical intervention is necessary. A healthcare provider may conduct tests to diagnose the specific liver condition causing the symptoms and prescribe medications aimed at improving liver function or managing the specific liver disease. In some cases, changes in diet and lifestyle, like reducing fat intake and avoiding alcohol, can significantly support liver health and reduce the accumulation of bile salts. For persistent cases, more specialized treatments under medical supervision might be necessary, such as therapies to bind bile acids in the gut or phototherapy, which uses ultraviolet light to ease severe itching. Engaging with healthcare professionals for a thorough assessment and tailored treatment plan is crucial for those experiencing itchy skin linked to liver problems, ensuring they receive the most effective care based on their specific health needs. 3. Bruising and bleeding easily. One of the more alarming signs that can indicate liver distress is an increased tendency to bruise and bleed easily. This occurs because the liver, when healthy, is responsible for producing several of the proteins necessary for blood clotting. If the liver is damaged, its ability to synthesize these vital clotting factors diminishes, leading to a deficiency. Consequently, even minor injuries can result in excessive bleeding, and bruises can appear with little to no apparent cause. This symptom is particularly concerning because it not only affects the skin's appearance but also points to potential internal bleeding risks, which can be far more serious. Common liver conditions that may lead to impaired clotting include cirrhosis and hepatitis. Early recognition of this symptom is crucial for preventing potentially life-threatening complications and managing the underlying liver disease effectively. Addressing the symptom of easy bruising and bleeding starts with dietary adjustments. Consuming foods rich in vitamin K, which is essential for blood clotting, can be beneficial. Leafy greens, broccoli, and Brussels sprouts are excellent sources of vitamin K. Additionally, your healthcare provider might recommend supplements if dietary intake isn't sufficient or if absorption is compromised due to liver damage. However, while nutritional support is important, it is typically not enough on its own. Medical evaluation and intervention are critical to manage the underlying liver condition causing the clotting issues. Depending on the severity and cause of the liver damage, treatment options can vary significantly. They might include medications to improve liver function, treatments specific to liver disease such as antivirals for hepatitis, or more invasive procedures if necessary. For individuals experiencing significant bleeding issues, medical professionals may also prescribe clotting factor concentrates or other therapies to directly address the clotting deficiencies. Regular monitoring and tests will likely be recommended to assess liver function and the effectiveness of the treatment plan. While dietary adjustments and supplements can support overall health and improve symptoms, they should be part of a broader, comprehensive approach guided by healthcare professionals. This ensures not only the management of symptoms like bruising and bleeding, but also addresses the root cause related to liver health. 4. Unusual body odor. Unusual body odor can be an unexpected indicator of liver malfunction. Typically, the liver helps to remove toxins from the body, but when it's impaired, these toxins can accumulate and affect the body's metabolism, including how it breaks down and utilizes substances. This buildup can alter the chemical composition of sweat, resulting in a distinct and often unpleasant body odor. This type of body odor is different from that caused by external factors like diet or personal hygiene. It has a more chemical or musty scent and can persist despite regular washing. The presence of an unusual body odor in the context of liver dysfunction is particularly concerning because it suggests a significant accumulation of toxins that the liver is no longer able to process effectively. This symptom could be associated with advanced liver conditions such as cirrhosis or acute liver failure, where the liver's capacity to function properly is greatly diminished. Addressing unusual body odor when it's linked to liver dysfunction involves more than just improving personal hygiene. While regular washing and the use of deodorants can help mask the odor, these steps do not address the underlying cause. It is essential to consult with a healthcare provider for a comprehensive assessment of liver function if this symptom is observed. A healthcare professional can conduct tests to evaluate liver health, including blood tests to check liver enzyme levels and other indicators of liver function. Based on the results, they might recommend changes in diet and lifestyle to help reduce the toxin load on the liver, or prescribe medications to improve liver function or treat the specific underlying liver condition. In cases where the liver disease is advanced, more intensive treatments such as hospitalization might be necessary to manage the symptoms and prevent further complications. Consulting a healthcare provider ensures that the unusual body odor is properly evaluated and that the correct course of action is taken to support liver health and overall well-being.
5.
Fatigue and weakness. Chronic fatigue and unexplained weakness are common symptoms in many liver conditions. When the liver is not functioning at its optimal capacity, it can disrupt various metabolic processes, leaving you feeling sluggish and drained of energy. The liver plays a critical role in storing and releasing glucose, which provides the body with energy. When the liver is damaged, its ability to regulate energy levels becomes compromised, often leading to feelings of constant tiredness, even after rest. Fatigue associated with liver dysfunction can be severe and persistent, affecting daily activities and overall quality of life. One of the most insidious aspects of the symptom is that it often develops gradually, making it easy to dismiss as simply a byproduct of stress or poor sleep. However, persistent fatigue that doesn't improve with rest is often a red flag. In many cases, this fatigue is coupled with weakness, where even simple tasks feel daunting and muscle strength may decline. Addressing fatigue and weakness related to liver dysfunction begins with a thorough medical evaluation. If liver disease is suspected, a healthcare provider can perform a series of tests, including blood work to assess liver function and imaging studies to look for signs of liver damage. Once the underlying liver condition is diagnosed, treatments can be tailored accordingly. For example, antiviral medications may be prescribed for hepatitis, or lifestyle changes such as a low-fat diet and avoiding alcohol may be recommended for cirrhosis. In cases where liver damage is advanced, additional interventions may be needed, including medications to improve liver function, nutritional support to address deficiencies, or even liver transplantation in extreme cases. Managing fatigue and weakness involves not just addressing the liver condition itself, but also supporting overall well-being through lifestyle changes, such as getting enough rest, eating a balanced diet, and staying hydrated. As liver function improves, these symptoms may gradually subside, and patients may find that they have more energy and strength to engage in daily activities. However, fatigue and weakness are not issues to be ignored, as they are often among the first signs that something is wrong with the liver. Early diagnosis and treatment are key to managing these symptoms and preventing more severe health complications. So, there you have it, the 5 surprising signs that your liver may be struggling. Recognizing these signs early on and seeking medical advice can make a world of difference in your liver's health and overall well-being. Don't ignore these symptoms. Your liver is counting on you to keep it healthy. Thanks for tuning in, and make sure to share this video with your loved ones. It could make all the difference.